Good afternoon, everybody, and thank you all for being here. I want to thank Director Jackson, Chief of Staff Mavronis, and the entire Monsi team, as well as our Health Commissioner, Dr. DeRosa, and the Health Department for putting a Child Fatality Review report together. Hold on a second. And really driving this important work. I also want to thank Adam Rosenberg, the Center for Hope, and all of the nonprofit community and partners who work every day to make Baltimore a safer place for young people. Last year's 300th homicide of 2021 was a 5-year-old girl who suffered from abuse and neglect. And in Baltimore, we have to be better and do better than that. Our young people are not just our future, they are our right now. They will be our leaders, our doctors, our innovators, and entrepreneurs of today and tomorrow. Each time we lose a child to violence, our city's future becomes more bleak and the future of our world becomes dimmer. It hurts me, not just as mayor, but as a black man who grew up in this neighborhood of Park Heights, someone who lost friends and lived through many of the same things we are discussing and that our young people face each and every day. Because we know these are losses that are overwhelmingly preventable. And as a city, we continue to lose too many of our young people to neglect and violence. These are children and teenagers who will never be able to grow into the full future for themselves and realize their true and full potential. We can save our young people, but it's going to take all of us, residents, city agencies, the child welfare system, law enforcement, elected officials, community-based organizations, and even the media working together to save our youth and preserve the future of our city and humanity. The Child Fatality Review Report ties directly into our shared commitment to equity throughout our city. An overwhelming majority of the young people we lose to violence each year are children of color. We cannot lift our black and brown communities out of poverty and overcome systematic disinvestment without specifically prioritizing the safety of our youth. This report is the product of a multi-agency reviews of individual deaths for young people under the age of 18, designed to help us understand why children die and determine what intervention should be put in place to effectively prevent future fatalities. One core recommendation of this report is that Baltimore City must develop a public health approach to violence, a central pillar of our comprehensive violence prevention plan. To do this, the Mayor's Office of Neighborhood Safety and Engagement, under the leadership of Director Shante Jackson, as the office spearheading our comprehensive violence strategy, and the Health Department will continue to partner with city schools, the Mayor's Office of Children and Family Success, represented by Deputy Mayor Leach today, the Department of Social Services, and others to support the pre-existing work associated with child fatality reviews. As a part of an unprecedented investment in public safety, that we are using American Rescue Plan offers $2 to enact agency level changes that shift long-term youth outcomes and prevent future failures, that support community-based organizations doing work related to juvenile justice, social emotional learning, and harm reduction for residents managing active addiction, and also to provide trauma-informed care training for Baltimore residents. We are following through on our promise to support young people by bringing a trauma-informed harm reduction approach to city government operations and our communities. We are taking seriously the recommendations contained in this report and focus on doing everything in our power to implement social and community support services to protect our young people and ensure a better, brighter future for Baltimore. I want to thank you all, and now I will turn it over to Dr. DeRosa. Dr. D?
Thank you, Mayor Scott, for your leadership and for your profound commitment to the health and safety of Baltimore City's youth. We deeply appreciate your urgent call to action on their behalf and the resources in the mayor's office that you have committed to preventing child fatalities. I want to also personally thank Director Jackson and Chief of Staff Mavronis, who's standing in her place, for her support of the Baltimore City Child Fatality Review Team over this past year, and for her efforts at convening leaders of city agencies and other partners to help with preventing child fatality and serving as our accountability partner in the mayor's office. I want to thank the Baltimore City Health Department staff and our Bureau of Maternal and Child Health who organize the Child Fatality Review Team every month. They gather and analyze data on deaths across the city, and they support the team to implement the recommendations that come out of those reviews. And last but certainly not least, I'd like to thank the members of the Baltimore City Child Fatality Review Team who have the very challenging responsibility of meeting every month to review cases of child fatalities in details and make recommendations for our city agencies, policymakers, healthcare providers, and the community at large on how we can work together to prevent these tragedies. As Commissioner of Health, I am responsible for chairing the Baltimore City Child Fatality Review Team. Child fatalities are what we call sentinel events. They represent the worst possible outcome and should urge a community to action. That's why our team undertakes these comprehensive multidisciplinary reviews of every unexpected death of a child living in Baltimore City from birth to the age of 17. Reviewing each tragedy exposes where our city systems are vulnerable and need strengthening to support our children and families. From 2016 to 2020, 208 children from birth to age 17 living in the city died unexpectedly. These deaths are heartbreaking and devastating for the families and Baltimore community as a whole. Today, we are releasing a report of these findings from those 208 case reviews and recommendations for prevention. These findings include that homicide was the leading cause of death of child fatality, claiming 69 children over these 5 years. The second leading cause of death was sleep-related. Victims of fatality were predominantly vulnerable infants and toddlers and 16 and 17-year-old young people struggling in school associated with the juvenile justice system. 90% of the children who died were children of color. Across all causes of fatality, the Child Fatality Review Team found that many of those children's parents and caregivers were struggling with substance use, mental health disorders, domestic violence, their own histories of abuse and neglect, poverty, and living in violent neighborhoods. 2/3 of the children were found to have 4 or more adverse childhood experiences, also known as ACEs, which indicates that they had experienced a high level of trauma and adversity in their short lives. Preventing these fatalities, as Mayor Scott mentioned, requires a public health approach that involves all agencies and providers serving families, and all of us as city residents. We must all simultaneously work to change policy, improve services, and mobilize communities. Tackling all of the prevention recommendations presented in this report may feel daunting, but all are shared because the urgency of this issue and the clear need for a multi-pronged approach warrants sharing them all. With the number of child homicides increasing over the past 5 years, we must especially focus on recommendations to prevent children from becoming victims of violence. Our city's youngest and most vulnerable residents are depending on us to act now to save their lives. The report elevates a subset of recommendations for immediate action, as well as longer-term actions over the next 3 to 5 years. I just want to raise a few of those. For our school age and older youth, providing comprehensive intervention and wraparound services for young people that are victims of non-fatal shootings and stabbings through the PAVE program here at the Center of Hope. Additionally, in partnership with city schools, identifying our young people who have multiple school-based risk factors for fatality, such as chronic absenteeism, repeating a grade, and multiple suspension. As we identify those young people, developing a plan to intervene early when those risk factors arise. For our infants and toddlers, continuing the Be More for Healthy Babies sleep campaign of mass media, community outreach, provider training, and free crib distributions to families in need to ensure that all of our babies are sleeping safely, alone, on their back, in a crib, and in a smoke-free environment. Additionally, working with our prenatal care providers and city's birthing hospitals to increase prenatal and postpartum referrals to the city's centralized intake system for pregnant women and infants that links them to a variety of community supports, including home visiting services intended to prevent abuse and neglect and promote positive parenting. And finally, we'll be working to institute an MOU outlining information sharing practices across our investigative agencies and a policy for multidisciplinary team meetings following child deaths to improve investigation and subsequent response. Thank you again, Mayor Scott, for your call to action, your leadership, and your commitment to resources. There is truly a role for each of us to play, and now is the time to act.
Good afternoon. I'm Adam Rosenberg. I'm the Executive Director at Center for Hope and the Vice President for Violence Intervention and Prevention here at LifeBridge Health. Mayor Scott, Commissioner Drossa, Director Jackson, thank you for this opportunity today. It is truly an honor and a privilege to stand in front of our soon-to-be open Center for Hope and join with all of you on behalf of our partners who meet and act upon a strategy to promote healthier outcomes by child fatality review. As everyone has said, this report shares not only 5 years of important learnings through painful analysis and reflection, but it also represents these 208 children whose lives were tragically cut short. The red desks that we have also here next to the podium have been part of a display and a campaign that we've used over the last year to recognize all these lives lost that should be sitting in school and instead are represented by such a red desk. This monthly review process is truly among the most important and the most heart-wrenching tasks that we all participate in. Those lives should never have been lost to begin with. We strive during each reviewed child death to make sure we can learn and do better for our city's children. Regrettably, with every life lost, there are many more children equally impacted and affected by their exposure or their witness to violence. Almost 10 to a dozen kids are impacted by each child fatality that occurs there, and so there's much more we can do with each child lost. We can do better to help these surviving children of homicides, their families, and prevent future trauma and death. And I'm very proud how this report outlines that strategy and has steps to take effect starting now. Thanks to the leadership of Neil Meltzer and LifeBridge Health, we launched our new Center for Hope in 2020 to address and solve these very issues that plague our city. And starting this spring, we'll be able to help thousands of children, caregivers, professionals, and community members to reignite hope when we open our new center behind me and hopefully on a warmer day. We look forward to truly inviting you back and working with everybody when we formally open up. As one call to action to a critical facet of these reviews that spotlighted the need for comprehensive intervention or wraparound services for youth victims of non-fatal shootings and stabbings, and they frequently become later victims of homicide themselves, we launched our Pathways to Advocacy Against Violence Every Day, known as PAVE. This collaboration is unique and it provides intense support to boost youth and family protective factors and prevent future community violence. It came directly out of the realizations that we found during our child fatality reviews. It is needs like this and identified calls to action through the report of the Baltimore City Child Fatality Review Team that we're proud to be a part of. Thank you for this chance to be a significant part of our efforts and working together to provide a better tomorrow and solutions for all of our city's children.
Thank you, Mayor Scott, Commissioner Drossa, and Adam. My name's Stephanie Mavronis. I serve as Chief of Staff for the Mayor's Office of Neighborhood Safety and Engagement, and I'm here on behalf of Director Shante Jackson, who is unable to be here today. The Mayor's Office of Neighborhood Safety and Engagement is honored to serve with the Child Fatality Review Team, and we're grateful for the partnership that's allowed us to take this work to the next level. We want to thank everyone who was a part of this work, including our city agencies, BPD, Dr. Santelices and city schools, the Department of Social Services, the Department of Juvenile Services, and of course, the Center for Hope. We also want to take a moment to thank the mayor for his commitment, not just to this work, but to the systems change that's required to avoid preventable deaths of children. Under Mayor Scott's leadership, this work has been taken to the next level with a focus on coordination and policy change that yields long-term impact. In the past 5 years, 208 children died in Baltimore City. In our close work together on child fatality reviews, we found that 91% of these deaths were preventable. That's 189 children that would still be here with us. That tells us that we must focus on identifying early those points where agencies and organizations serving youth and families can intervene before it's too late. Now that the report's public, let's talk about what comes next. Thanks to Mayor Scott's historic $50 million American Rescue Plan Act investment in violence prevention and strong commitment to this work, we'll be able to fund the difficult yet necessary systems changes that will save lives. That means the recommendations you find in this report won't just sit in a document, but have implementation dollars and true buy-in behind them, thanks to the mayor. Our office will deploy $1.25 million over 3 years to advance this work. You may have noticed that the child fatality review work is included in the mayor's comprehensive violence prevention plan. It's part of our youth justice work associated with a public health approach to violence. The Mayor's Office of Neighborhood Safety and Engagement, MONSE, will serve as the accountability partner for agencies as they implement changes to policy and procedures with the power to shift outcomes for Baltimore's young people. As a reminder to those watching and listening, MONSE has grant dollars available for organizations doing youth justice work. We have $925,000 specifically available for youth and trauma proposals. You can access the grant portal and submit a letter of inquiry at monse.baltimorecity.gov. That's MONSE. We're also prioritizing proposals related to community violence intervention, victim services, community healing, and reentry. We look forward to continuing to partner with the Baltimore community as we strive to co-produce public safety. Thank you.
Thank you, Stephanie, and thank you to Adam and Dr. D and all our partners. As you know, curing Baltimore of violence is my top responsibility and priority as mayor, and something that really falls on the shoulders of all of us gathered and everyone who lives and thinks that Baltimore is their home and their city. We know that this work has been going on for years, and some of you may ask, what's new this time around, and how are we going to stop this trend or buck the trend that we've been seeing for at least 4 decades, where we continue to lose young people. To say I say something very simple. It will be different because we know things have to change. And while this work has been going on for years, we are committed to implementing new and innovative solutions to address and preventing youth fatalities. Status quo solutions has been proven not to work, and we will be a catalyst for meaningful policy and systems change by working with our community partners in a much deeper way. That is what we're doing each and every day through our comprehensive violence prevention plan and many other initiatives. The dollar and brain power that we invest into this report's recommendations, this vision based on equity, healing, public health, trauma-informed practices will build safer neighborhoods, especially for our children, and do that today and pay dividends in the future. And now we'll open it up for a few questions. Know your code. Alexa. Hold on.
Is it on?
No. It's on up here, but not out there. Well, it's cold. Come on, Alexa, ask it anyway. You look like you're freezing. That's all right, don't worry, go ahead.
Okay.
Okay.
So we know DHS and CPS has been under a consent decree for many, many years. Children are falling through the cracks. Does this report address how that can be changed? Is the city doing anything in response to that?
So, as you know, we'll be working with our partners at the state as we try to suggest changes to how they deal with DHS and DHS. That we're going to be partners with them each and every day. The report, as you know, talks about some policy changes that we need to impact, and many of those will be beyond what the city can do. But this is about partnership, because even for agencies that are under the control of the governor or someone else, we all have to work together, Alexa, to make sure that our children are safer. So,
next question I have.
you're good. Sorry.
We've had 20 homicides in 20 days, as you know. What is the city, what is your office doing right now to address that?
Well, we're doing it every day. We're deploying our violence interrupters out there. We are devastated that we lost one of them. We're making sure that our police are where they need to be. We are continuing to attack those who have guns and bring guns into our city. We are doing things to prevent things in the future, like go to Annapolis and ask them to ban ghost guns, which we are seeing a significant amount on our streets. We're going to Annapolis to talk about how we should have better communication from our criminal justice partners to our police department. We are going to continue to work with our federal partners to take down organizations and people who are committing violence in the city and turn them over to the other parts of the criminal justice system. And we're going to also do this work that we're talking about here today, building and furthering that community violence intervention work, focusing in on trauma. It's a all hands on decks, all 24/7, 365 approach for us, Alexa.
Are police beefing up resources?
Our police department will be, I never will discuss deployment. Our police department will be deployed appropriately where they need to be, focused on who they need to be focused on and what they need to be focused on.
My last question is, do you support the curfew, the 10 p.m. curfew on the block?
Well, we're going to be talking to our partners. Senate President Ferguson and I have had some initial comments about that. As you know, as you have talked to me on the block after some issues of violence, we know that there's far too much violence that happens there. It happens in front of police officers. We had an incident this past summer where some coward was about to shoot 4 women in the back, and a police officer just happened to be there and intervene, and unfortunately had to shoot that gentleman, but that gentleman was placed under arrest. Of course, we are going to make sure that we're working with our state partners to do whatever we can do to bring down violence in Baltimore, and we'll be looking forward to working with the Senate President on that legislation. Thank you. Emily? One half of Emily Squared today?
Just one. Good afternoon, everyone. My first question is about a statistic in the report. It said that clusters of youth homicides where the youth were killed by non-family members happened in neighborhoods largely that were not covered by safe streets. And one of the recommendations was to bring safe streets into those neighborhoods. So I would like to know what youth-targeted strategies that violence interrupters have for youth specifically.
Yeah, I think that as we're talking about that expansion of our violence intervention work, one of the things that we talk about is the work that how we can take that to young people. Do we take it into the schools? Do we do it in a youth-focused way? And that's the work that Director Jackson and all of our folks at Monty are leading, and we'll be able to come back to you with the full review of what we're going to do in that way. But this is why we know we need this work to expand, right? If you heard just the story that the Sun ran about the safe streets in Bella Edison, where you saw that someone wanted to kill a young boy simply because shoot a young boy because he ran into a car with a scooter, right? These are the things that our young people are facing, and why we have to evolve our thinking of what it means to interrupt violence in Baltimore.
And then last question, this number, the 208 number, was lower than the previous 5-year period. Were there any strategies that we think contributed to the decrease that are worth talking about?
Yeah, I'll let Dr. D talk about be more healthy babies. We know that one works, right? We know in the neighborhoods in West Baltimore where we have that work focus and why we want to expand it, that child fatalities there, infant deaths there are just as low as they are in Roland Park and other areas. So these are proven things that work, and we need to build those strategies up and continue them in other places. Thank you, everybody.
Thank you.